everyone. I am a nurse. I've been a nurse for 24 years, extensive from hospital nursing to now where I'm doing case management and manager value-based care. Today's topic is a very hot topic. Us ladies always want to know about this. I myself have been very intrigued in this topic and have done a lot of personal research myself on healthy aging and menopause. I would like to first thank everybody for joining today. Whether you're here because you're experiencing menopause yourself, supporting someone who is, or simply just, planning ahead, you've already taken an important step towards, your health. Today, we're going to dive a little bit into menopause and healthy aging. My hope is that when you leave today, you have a better understanding of what is happening in your body, why these changes occur, and most importantly, what you can do to continue to feel healthy and confident. One thing I like everyone to remember is this menopause is not an illness. It's a natural life transition that we go through. Just like puberty, our bodies are designed to go through these hormonal changes. While every woman's experience is different, there are many ways that we can manage our symptoms, continue living active, healthy lives, and just trying to feel the best that we possibly can. We'll go ahead and go into the next slide. Okay, the number one question here. What is menopause? We hear about it everywhere on the TV, on podcasts, on our newsstands, while we're at the HEB in line. So let's begin with the basics. Menopause officially occurs after you've gone 12 consecutive months without having a menstrual period. At that point, your ovaries have significantly decreased the production of estrogen and progesterone, the hormones responsible for regulating our menstrual cycles and supporting many functions throughout your body. Most women enter menopause between the ages of 45 and 55, although some experience it earlier due to either genetics, medical conditions, surgery, chemotherapy, or other factors may come into play. Other common misconceptions is that menopause happens overnight. And actually, in reality, it's a gradual process that often takes several years. Many of us start feeling those effects in our mid to late 30s into our 40s. We get those fluctuations. We know something's going on, but we're kind of unsure. That is the perimenopause. Because hormones affect nearly every organ system, menopause can influence much more than your reproductive health. It can affect your sleep, your mood, your memory, your metabolism, bones, heart, skin, and even your urinary health. The important thing that we all need to know is that these changes are very common, and you're certainly not alone in experiencing these things. We'll go into the next slide. So let's talk about the different stages of menopause. As I said before, we have perimenopause. This is where we start seeing the body changing. We're starting to see little subtle changes, things that are making us feel a little off. There's 3 stages of menopause, and understanding them help explains why symptoms can start long before your periods actually stop. Okay, the first stage, perimenopause. This can begin several years and up to 10 years before actual menopause kicks in. During this time, estrogen levels fluctuate dramatically. Your periods may become irregular, lighter, heavier, closer together, or farther apart. Many women experience symptoms during this stage, even though they're still having a menstrual cycle. The How many of y'all have experienced, that rage you feel like right before your cycle, or the depression? You feel like, oh my gosh, what's going on? I feel, so overwhelmed, and you're like, what is going on with me? And you go to your doctor and they're like, oh, everything's fine. Everything looks good. But you're like, I'm just not feeling myself. That is perimenopause. The second stage is menopause. Okay, so we're hitting this menopause stage they talk about, which is simply defined as going 1 full year without a menstrual period. Then you have your final stage, which is postmenopause. And technically, that is day one after you've completed that 12 months of no period. You're in postmenopause. And this continues for the rest of our lives. While many symptoms improve over time, the lower estrogen levels continue to affect your bone health, your heart health, and overall wellness, making preventive care especially important. Okay, let's go into the next slide and let's talk about some of these common symptoms. When most people hear the word menopause, they immediately think hot flashes. Um, I don't know how many of you significant others, you start sweating and then like my husband will be, oh, are you having a hot flash? And it's like, okay, really? You always want to throw that at me? But that is the number one symptom that, as women, we suffer from. While hot flashes are certainly common, menopause can bring a variety of symptoms because our hormones influence so many different parts of our body. Some of the most common symptoms include the night sweats, difficulty sleeping. You're able to fall asleep, but then here comes 3 o'clock in the morning and you wake up and you can't fall back to sleep. And it's like clockwork. Your mood changes. You get more irritable. You have crying spells. Anxiety increases, trouble concentrating, that brain fog. You could be going into the kitchen. I used to do this many times, go into the kitchen. I was like, open up the fridge. I was like, okay, what was I going to grab? I totally forgot what I was going to get. But that brain fog is very substantial. Fatigue, just tired, what you used to enjoy doing, going out walking, and now it's just, it's a big task. Another one a lot of people don't like to talk about, your vaginal area changes. You have more vaginal dryness. Another huge one that women see is the weight gain, particularly around our abdominal area. It's like it's overnight. It's like, where did this little belly pooch come from? Um, One thing I've always liked to emphasize is that every woman experience is unique. It is your own. Um, Some women have very mild symptoms, while others find symptoms significantly affect their daily lives. Neither experience is more normal than the other. Anybody have any questions about any symptoms you may be experiencing? Anything that you wanted to know about? Okay, we will go on to the next slide. Why these changes happen. So, why does menopause affect so many different areas in our lives? Estrogen does more than regulate our menstrual cycles. It supports heart health by helping keep our blood vessels flexible. It influences our brain function, memory, mood, skin, elasticity, our bladder function, and even how our bodies regulate our temperature. As our estrogen levels decline, it's completely normal to notice changes in all these areas. That's why women sometimes they don't quite feel like themselves during menopause. It's not because they're imagining it, it's a real hormonal change that's happening throughout our body. And like we talked about in the previous slide, your body temperature regulation changes. Um, Bones get affected. I don't know how many of y'all have been suffering from, joint pain. It's like yesterday I was perfectly fine, and now my elbows and knees are just hurting, and I don't know why. Again, that brain fog and that overwhelming fatigue, very, very common, symptoms. We'll go to the next slide. So let's talk about just some basics on our healthy aging. The good news is that healthy habits become even more powerful during this stage of life. Although we can't stop menopause, we can absolutely influence how we age and how we're going to embrace all these changes. The four foundations I'm going to focus on are eating nutritious foods, eating your balanced meals. Staying physically active is very important, as I discussed earlier, those joint pains, that fatigue. Well, we want to make sure we continue to stay active and try to build up our muscles because that's very important as we age. Prioritizing our quality of sleep, and maintaining those social connections. As we're going through this stage, all these ailments coming on us at once, mentally, physically, we want to, a lot of people end up just staying away from others and not wanting to engage, and then depression kicks in. So we want to keep our physical, our mental health well, so we can age healthy and gracefully. We're going to go into slide 7. So, some healthy foods for menopause. Okay, well, what can I do? What will help me during this stage? What should I, incorporate more of? Nutrition plays a huge role in helping us manage our menopause symptoms. Our bodies now require a little extra attention. So let's see how we can get these extra nutrients to our body. Calcium and vitamin D become increasingly important because as we age, our bones naturally will lose density. And most of us are already vitamin D deficient. Protein helps preserve muscle mass, which naturally declines with age also. So we can find these in our fruits and vegetables to provide those antioxidants to help protect our cells. Whole grains and fibers support heart health and our gut health. And something many women underestimate is hydration. And I'm guilty of that, is we have to hydrate. Um, Limit our soda intake, but hydrate, with our water. And that helps replenish our cells, and it actually will help keep some of that weight off us, is that hydration. So, and it will also help with our energy levels, headaches, even some hot flash symptoms. Hydration can actually help with that. Some women also notice that caffeine, alcohol, spicy foods, or sugary foods can trigger hot flashes, or that indigestion, heartburn, those gut issues that we see more, you know, prominent now as we've aged. Keeping a food journal can sometimes help, identify some triggers. We're going to go into the next slide. So, moving your body. Exercise doesn't have to be intimidating. You don't have to go do your Zumba class every day of the week or get on those uh those health kicks of like the P90X. I don't know who remembers that. I don't know if I'm dating myself, but P90X was like a big thing. Just doing stuff in moderation is perfect. The goal isn't perfection, it's just being consistent. Walk with a friend, take a dance class, go swimming, gardening, even playing, with your grandchildren, if some of you have some, or your dogs or cats. Strength training, just lifting some weights, is increasingly helpful for our bones. Stretching for flexibility is wonderful. Tai Chi is super beneficial to our body. They have like some simple classes that you can even do online to try those out. You want to aim for at least 150 minutes a week. So you can break it up however you like. So you don't have to feel like you have to get in an hour every day. 15 to 30 minutes a day is perfect. But there's so many little steps that we can take and just keep, our body moving. It all counts. I especially encourage, the strength training again because it helps maintain our muscle mass, improves our balance, reduces falls as, we go into this age of life. Falls is a huge, huge risk for us. And so we want to protect our bones and keep them, from breaking and having those severe breaks, those hips, those fractured legs. So just, even 2 days a week of light resistance exercise can make a huge difference. And it will also help with your mood, that extra little weight gain that we tend to put on during this stage. So definitely movement, movement, movement. Let's go ahead and go into the next slide. So how do we manage these symptoms at home? What can I do? dress in layers for these hot flashes. I know I have a battle with my husband at home because I'm always dropping the AC down and he's like, it's freezing. And so we have to come to a happy, medium. Okay, I'll you know, try to dress down as much as I can, but it's like, okay, well, can I lower the AC and can you put on a little extra layer? So we come to a happy medium there. You can use a fan at night. I use that. I have a cooling pillow also, but it's been helping me tremendously. Relaxation, deep breathing techniques. These have been shown to reduce the frequency of hot flashes for some women. So doing, those meditation moments are really, really helpful. For the vaginal dryness, over-the-counter moisturizers and lubricants are safe, effective options that many women find helpful. And sometimes those are things, it's kind of like, I don't really want to talk about it, but these are all natural things that we're going through, and we're not alone. So definitely, there's things out there to help us. Okay, let's go to the next slide. So let's talk about treatment options. If symptoms begin interfering with your quality of life, please do not suffer in silence. There's so many treatment options available. Some women benefit from hormone replacement therapy, while others, may prefer non-hormonal medications. And I know there's a huge this is a huge topic on hormones. But definitely this is a talk you want to have with your provider, and see if you're a good candidate. And actually, most women are a good candidate for HRT. Um, Lifestyle changes often, remain the foundation of treatment, like I said, doing the layers, doing meditation, if you want to treat it, more holistically. Supplements, only if recommended. You just don't want to go over, to your GNC and start grabbing all these, supplements because, you heard on TikTok that, oh, this works. Always definitely check with your provider, that it's something that is okay for you and then it doesn't, counteract with any other medications that you may be on. Safety is the most important. Does anybody have any questions in relations to the treatments or the hormone therapy? Nope. Okay, we'll go ahead and go. Let's go into going a little bit deeper into the next slide into our bone health. So bone health, like I was stating earlier, is very, very important for us at this age, because this is the one area that really changes after menopause. So estrogen actually helps protect our bones. So when the estrogen levels drop, bone loss can happen faster. This increases your risk of osteoporosis, which makes bones weaker and more likely to break. The tricky part is you don't usually feel the bone loss happening, and it's often silent, until there's a fracture and it's too late. This is where prevention really becomes important. So making sure you're getting enough calcium, vitamin D. Let's see, we had a question there. But what age should we start testing if we see, what was that? The premenopause. Heather, were you able to see that question on the premenopause? What age was able to
It
test?
says but at what age should you start testing to see if we are premenopausal?
So yes. So on that question, if you're in perimenopause and you're still experiencing your monthly cycles, it's very hard to actually do true testing because you're still cycling. So any lab test you're going to do, your estrogen and progesterone values are going to be out of whack one week and then looking normal the next week. So you don't really want to go off of testing. You want to go off of your symptoms. If you're experiencing any of those symptoms, that's definitely something, you want to bring up with your provider. Um, and your provider would want to base off of symptoms, not as opposed to lab results. As you go into menopause, true menopause, then we can actually measure, okay, what are we low in? Are we low in estrogen, progesterone, testosterone? That's when we can get a true level value. So I hope that answers your question. The next one was about lubrication, right? Correct? Yes, okay, perfect.
Yes.
So, on lubrication, you want to use anything that is a natural, like silicone based. Those are really good. You don't want to, you can actually even do a coconut oil. You don't want to get all crazy and use anything that has like any sugar base or anything like that, because that can lead to, of course, a yeast infection or a UTI. So anything water based or a silicone based is good. Any other questions on that? Those are good questions. I'm getting enough sleep, but we have trouble sleeping. Let me see here. Oh, here we go.
Um,
We have trouble sleeping.
Getting enough sleep, but we have trouble sleeping.
Okay,
What can we
yes.
do to get enough sleep?
Oh, yes, I know how that is. So again, if you are in the perimenopause stage, that would definitely be a symptom you want to speak with your provider. Now, if you're menopause stage, that's definitely something that is linked to low progesterone or no progesterone. So that's definitely something you can talk with your provider about. Um, for sleep, I just keep it very cool in the room, making sure it's dark. And you could talk with your provider about you using the magnesium glycinate helps, with sleep. So those are some things, but definitely, discuss with your provider that if this is an ongoing issue. Um, because I know exactly how that feels. Is UTIs a common thing yet? Yes. Unfortunately, as we're going through this stage in life, because of the declining hormones, our vaginal tissue changes and we become more susceptible to UTIs. So again, that is something to definitely talk with your provider if you're experiencing, more frequent UTIs. But it is very common as we go through this stage in life, unfortunately. Any other questions? These are fabulous. You're welcome. How safe on being on the patch? Actually, the patch is very safe. The Women's Initiative in 1980s had done a big research study, and it was HRT's bad, HRT's dangerous, but actually, they came back and found that there was not enough data and there was a big scare. So there's so much research and data put into this now. HRT is actually very safe and very beneficial, and is actually something that we need to protect us as we grow older. The patch is, I'm actually on the patch, and it's very easy to use. You put it on twice a week, you change it out, very safe, and very beneficial. So if that's something, you definitely want to talk with your provider if that's something you're thinking of. But I do have later on, we'll discuss on how to bring up these questions with your provider. Let's see, I think we have another one. Any side effects on breast cancer and heart risk involved? Actually, there is no linked data that being on the estrogen patch increases your risk of breast cancer, or it's actually heart protective. So it's actually very important that we're on the estrogen. And it's actually not estrogen, it's a bioidentical estradiol. And that's what the body needs, is this estradiol, and that's what actually provides us the heart protection that we need. But it does not increase your risk of breast cancer. But you do want to have that discussion with your provider if you have any family history of breast cancer. So thank you for these wonderful questions. Okay, so I think we can go. Actually, we can now finish up with our bone health and let's go into our heart health. Next slide, Heather. All right. So going on back onto the heart health question, actually being in menopause can raise your heart risk. So we want to choose our food, stay active, know your blood pressure, cholesterol. Another big thing we see as we're going through that change, um, you'll start seeing your cholesterol going up. And it's like, wait, I've always had normal cholesterol. Why is my cholesterol suddenly going up? Why is my blood glucose going up? These are actually signs that we're going through menopause. So our heart health is very, very important. I see there's a question here. Does birth control impact anything? So birth control is going to be different hormones in that birth control. So if you're in the perimenopause stage and you're on birth control, that's definitely something you would have to talk to your provider about because usually they wouldn't do the birth control and then put you on a hormone replacement therapy. So it could impact. Does hormone therapy affect your LDL? Actually, it affects it in a beneficial way because as your hormone levels start getting to a more therapeutic level, and you'll start seeing those LDLs start going down and trending down. A lot of providers are quick to see that aren't well versed in women's health, want to automatically put you on a statin. So definitely have that talk with your provider if you're thinking you may be perimenopause, menopause, you're seeing your LDLs go up. Be quick to be like, hey, can we talk about, the symptoms I might go through? Is this possible menopause? Just be don't a lot of providers are quick to put on medicines and not truly listen to you. So definitely be an advocate for yourself. Heart health is, again, very important. Estrogen provides protection for the heart. This is why, you might hear your provider focus more on things like your blood pressure, cholesterol, weight around this stage of life. But there's so much we can do to help reduce that risk. Um, so just make sure you're keeping your regular checkups, making sure you're checking your blood pressure, you're having your labs drawn yearly, or as needed to monitor these things. And really about prevention, taking small steps now, is the best thing we can do for, to help prevent these bigger issues. Thank you. I'm in postmenopause and wanted to give me a statin, but don't want to. Oh, I hear you, Daisy. I've been in that position as well. But if you're in postmenopause and you're not on HRT or, want to do some other things to help, with your menopause symptoms, definitely talk with, your provider about your concerns. And, let them know, hey, whoa, before you start trying to throw this at me, can we look at this, XYZ. So definitely understand where you're coming from. So next slide, please. Sleep tips. I know we've touched on this a little bit, but this is so huge for us. So again, let's just keep a bedtime routine. I know that's hard, but try to make that a focus. We get busy with life, children, all work, everything else. So we have to take that time out to ourselves and really take care of ourselves and try to keep a routine. Limit your caffeine intake. Keep your room cool or cold if you can. And, talk to your provider if it's just, becoming troublesome and it's impacting, your quality of life. Definitely talk to your provider. Next slide, please. Okay, our emotional well-being. This is so important. As women, we tend to carry the weight of the world on our shoulders, but that's what we do. So taking care of our emotional well-being is so important, especially through this time in our lives. The mood changes are so common. Um, let's let's hormonal changes during menopause can affect your mood. You might feel more irritable. Again, like I said, anxious, overwhelmed, or just not like yourself. A little story to touch on myself, because I was going through this. I became menopausal as a post-hysterectomy. And so there was really nothing to, I didn't have like a cycle, it just abruptly stopped. So they left me one ovary, which was supposed to maintain my hormones. So I started having these symptoms of anxiety. It was just like going through the roof. I would have like crying spells, and I was like, what is wrong with me? Uh, am I stressed? Am I not? So I actually had talked to a friend about it, and she's like, wow, you sound like you might be in menopause. So she referred me over to a provider, and he's like, you know what, let's get your levels taken care of. And, I got into my HRT, and I haven't had an anxiety attack, knock on wood. So just those things that we're thinking we're losing our minds is actually, 9 out of 10 times hormone related. So those are all things that we go through. So you're not alone if you're feeling this, and just know that there's treatment. Um, it's important to recognize, I guess, your mental, your emotional health matters just as much as your physical health. Things like taking time to yourself, staying connected with friends and family, and doing activities that you enjoy make a difference. Um, put you first, because if we can't put ourselves first, we won't be there to take care of the ones we love. So we need to put ourselves first. Next slide. All right, here's a good one. Oh, here's a question. Is progesterone bad? Does it cause side effects? I heard it does. Just worry about. Progesterone is actually very beneficial for our sleep. It is a more sedative type hormone. Um, so progesterone. So if you are in menopause and have a uterus, if you do get on hormone therapy, if you're taking estrogen, you do have to take progesterone with that if you have a uterus. Progesterone is to help protects the uterine lining, and that helps reduce the risk of any type of uterine cancer. If you had a hysterectomy without a uterus, you do not need to take progesterone. But the benefits of progesterone, like I said, helps with that anxiety, it helps with your mood, and it tremendously helps with your sleep. So, as side effects, that's definitely every individual's different. So I really couldn't say if there's any true side effects from it. But that's definitely something, if you are on it, your clinician will monitor your blood levels to see where you're at. And of course, always let them know any symptoms that you're having. So I hope that answers your question. Is there meds for anxiety because it's been getting crazy? Yes. So that's like I said, the anxiety tends to go berserk during the stage. And again, if your provider is not, well versed in women's health, they want to automatically put you on an antidepressant. So definitely have that talk with them. Is it true anxiety or is it hormone related? But again, if you're in that perimenopause stage, it's kind of hard to test your levels because you are still cycling and your hormones are up and down. If you are menopausal and you're having this increased anxiety, this is definitely something to bring up with your provider and say, hey, can we test my all my hormone levels to see if I'm in menopause. So I hope that answers your question, but definitely the anxiety is something to definitely talk with your provider about, and is very, very common. Back on, we'll go over here to sexual health because this is important as women. Um, we experience that dryness. It's a normal phase. It's a normal, but we don't have to keep it this way. It's very treatable. So like we talked about earlier, you can use those lubricants, those silicone water-based lubricants. You can do your pelvic floor exercises if you're, experiencing discomfort, during intimacy. You want to strengthen those uh, pelvic floor muscles, and communicate with your partner. So these are definite things we can do, and definitely have this talk with your provider, that this is what you're experiencing. And, this is a very common issue that we women go through, but know that it's definitely treatable. So there's definitely a rainbow on the other side. So we're going to go to the next slide. And this is how when to talk to your provider and how are we going to do this? So I'm going to have Heather click on this little YouTube clip, and this is a really good clip. Heather, is it on? Heather, can you hear me? Can everybody hear it? Anybody, can you message in the chat if you can hear or see the clip?
Were you able to hear? Are you able to hear it?
No. Oh, I
Okay, so
couldn't.
let me try to share.
So we have some that hear, some that see, and I don't have any. Here we go. I can see it. Let's see. I cannot hear it. We're not able to hear. Well, I guess. Well, I can kind of tell you, I've seen this clip many times, so I can actually just kind of go over it with you. That's okay, Heather. I guess we're having some audio issues. Okay, so basically what this clip is talking about how to bring up this conversation with your provider. So you definitely want to make a specific appointment to discuss these concerns that you have. You don't want to do it during your, wellness exam, because that time is actually allotted just for, your wellness exam, and you won't be able to get the true amount of time that's needed to have this conversation. You definitely want to let them know. Start keeping a journal of, the symptoms that you're experiencing. If it's been sleep disturbance, let's keep a journal. How long has this been happening? When did it start? Do you see a trend? If you're having the brain fog, how long did this happen? When is it happening? The hot flashes, how long? You want to, have all this at your appointment, and you want to be allotted at least, a good 30 minutes to talk with your provider about these concerns, and these symptoms that you're experiencing. Um, so definitely, provide them with your questions. If you feel you're not getting, you know, the answers, or you feel like you're being a little dismissive, then definitely that's a time to maybe reach out. You can reach out to Heather or our case management team, and maybe we can help you find a provider that is maybe more educated in women's health and menopause. Because I know, I've experienced it myself. A provider just wants to be quick to put you on other things and not truly listen to what you're saying. So you definitely want to go in with your ammunition, let them know, look, this is what's going on with me. What can we do? Let's get the ball rolling. So that's basically how it is on Talk to Your Doctor About Menopause, and any issues that you may have. Um, Sometimes, women, as when we think, oh, it's just menopause, I'll push through it. Our grandmothers did it, but no, you don't have to push through it. There's so many treatments, and there's so many resources that's available to us out there. Um, just reach out again to your provider, reach out to us, and we can definitely help you, and get you to maybe, the right provider for you that can help you in this stage of life. We're going to go ahead and go to our next slide. I believe it's our last slide. Um, so to wrap it up, I just want to leave you with some resources that you can trust. There's a lot of information online, but not all of it's accurate. So these resources are reliable and can help you learn more about menopause treatments, options, and finding that right provider. If you ever feel unsure, overwhelmed, or just, want more information, these are great places to start. And you have the Menopause Society. This is provider directory for certified menopause practitioners. So if you go onto this website in the Menopause Society, you can actually look at certified menopause practitioners in our specific area. And if you find one that you may like, you can definitely shoot us over an email, or reach out to the Cupid Case Management team, and we can actually see if they are in your network. There's the Pause Live. Sucor is for it's a 24-hour like urgent care psychiatric need. If you're ever having those moments where you're just feeling overwhelmed, that anxiety, and you just need someone to talk to, we have Sucor that's available to you. JTA Wellness, I've utilized them myself, is a great resource for nutrition, and it's part of our benefits, and great nutrition, especially, for menopause. Our Cupid case management team, or and to Heather also, our email is the QPICCM@healthtexas.org. Feel free to email us anytime with any questions that you may have. May I get your information to get a new ER provider? I feel yes, definitely. If you can email this, Patricia, this email, the QPICCM@healthtexas.org. Yes, we will definitely, I'll have either Carmen or Marquette, those are my case managers, will reach out to you directly, and get you over to a provider that will help be more supportive in this journey for you. So definitely, we'll be looking for that. To wrap it up, I want to leave you with these resources. And the most important takeaway from today is this: you're not alone in this. They're real effective ways to better and stay healthy through this stage of our life. This is a new phase of life, but it can be a very strong and healthy one. And we're all in it together. So I thank you again so much for your wonderful questions, and joining, me today. And again, if you have any questions, you reach out to us. Oh, thank you, Norma.
So
Y'all have a
before we
wonderful
wrap it
day.
up, are there any additional questions that you have for Yvonne right now? You can take yourself off of mute or you can post it in the chat.
No. Oh, you're welcome.
Okay. Well, if there aren't any more questions, then thank you guys for joining us. We greatly appreciate it. And once the recording is available, I'll be able to get it out to you guys. Again, thank you for being here.
Y'all have a wonderful day.